Hey Vet Techs, I'm Justin from Vet Tech Ambassadors, and on this episode of Elevate, we're going to be talking about basic principles of triage. Now, I can't say I'm shocked to see you here. I know you're all dying to get this critical information. After this video, you'll have your finger on the pulse of triage, so let's go bounding headfirst into this thread of information. That way, when your patients aren't doing so hot, you know the stables have turned on this episode of Elevate. And welcome back. Before we get started, don't forget to hit the like button. If you'd like to see our next video as soon as it drops, hit that subscribe button and the bell. Okay, so triage. When you have so much time and so little to do. Wait, scratch that, reverse it. So everything you need to know about triage is right here. Just memorize this list and you got it. Okay, that's all the time we have for today, folks. Thanks for watching, guys. I'm Justin for Veterinary Technician Ambassadors, and we'll see you next time on Elevate. Oh, hello. What are you still doing here? I just gave you everything you need to know about triage. Now, go on, assess some patients. Go on. What's that? It's not enough? Do you want more? Well, I guess I could be persuaded to talk a little bit more about triage. Okay, here it goes. First, we're going to talk about the role of the CSR, or Customer Service Representative, in patient intake in an emergency and critical care setting. Then we'll talk about the role of the technician and a few words about the doctor's role in this setting. The CSR is the face of the hospital. In any setting, they're often the first and the last person the client interacts with. But in some cases, they may have little or no medical knowledge and so rely on the technician to make important decisions about who gets seen first. Being a cohesive team with the technician is the first step in setting good expectations for the client. Together, the CSR and tech must send a clear, consistent message. The CSR can help the tech keep the owner updated about change in status of the patient. If the CSR is telling the client one thing and the technician is telling the client another, this can affect the way the client interacts with the hospital staff in a big way. An unclear or contradictory message looks unprofessional and can even cause the client to question the hospital staff competency. Sending a clear, consistent message can help the client feel more stable in already uncertain times. CSRs, you're often the first to have eyes on the patient, so you should at the very least have a rudimentary understanding of the three components of triage. What are those? The technician is the backbone of triage. Like so many other things in the hospital, they are the doctor's eyes and ears. When something looks off, they notify the doctor. When it comes to the technician's role, triage has three components. 1. Setting expectations. 2. The primary survey. And 3, the patient history. There may be more bells and whistles that you can add to that, but without these three elements, things go off the rails. The first thing that should be done when you go and assess a patient is set expectations for the client. As mentioned before, they're already in a state of uncertainty, so if you could give them an idea of what's going to come next, it can give them a sense of predictability during a very unpredictable time. Tell them what's happening now, then tell them what will happen next, then give them a loose time frame of when that'll happen. An example of this could be, hey, my name is Justin. I'm just coming out to take a look at Fluffy and get a little bit more information. The wait time right now is about 1 hour. Once a doctor picks up your case, we'll send a technician out to bring Fluffy to our treatment area, and then the doctor's going to take a look. Then they'll give you a call to talk about a plan for treatment. Always give the disclaimer that this is an emergency environment, and should a greater emergency come in, they would have to be set aside for a moment and then readdressed after taking care of that greater emergency. An example of this might look like, hi, is this Fluffy? Hi, Miss Rogers. My name is Justin. I'm just coming out to take a look at Fluffy. Can you tell me what's going on? Hi, yeah, Miss, I can see you're very worried about Fluffy. We're going to figure out what's going on, okay? Her ears do look very inflamed. She does look very uncomfortable. I agree. Okay, so I've taken a look at her vitals, and her heart sounds good. Her pulses are nice and strong, her gums are nice and pink, and she seems to respond pretty well when I interact with her. Right now, our current wait time is about 3 hours. We can certainly see you today. It'll just take a while. We've had several emergencies that have come in this afternoon. We have to address those before getting to Fluffy. If it's a true stat that needs to be addressed right away, send 2 technicians out, for one to take the animal immediately and the other to take a short history, which we'll talk about in a later segment. An example of this might look like, "Hi, my name is Justin. This is Bob. Bob's going to take Fluffy to our treatment area and we're going to have a doctor take a look at him right away. If the doctor thinks it's necessary, is it okay to give emergency treatments or do you want to talk to a doctor first? A rough estimate is anywhere from $500 to $1,500 to start." Okay. Here you go, Bob. Okay, now I'm just going to ask you a few questions about what's going on. We're going to take care of Fluffy, okay? After the doctor takes a look, they're going to give you a call right away and we'll talk about what needs to be done next. Be kind but direct. Some owners may be in such a state of disarray that they're not initially able to communicate anything clearly to you. Recognize and validate their emotional state, then ask them direct questions in a compassionate way. One example might be, "I know this is a really stressful moment. I just need to get a little information so we can figure out what's going on and get Fluffy what he needs." The next component of triage is the primary survey. I recommend using the 6 perfusion parameters. There are 6 simple things that anybody can look at when you're talking to a client and getting a short history. All 6 of these can be assessed right in front of the owner, assuming the patient lets you touch them, and gives you a wealth of information about that patient's current state. Most emergencies really boil down to the question, is this patient in shock or pain? These 6 parameters cover almost all the bases. Now, in a future video, we'll address how to assess pain, the basics of shock, and then do even future videos going into deep dives about each type of shock and the type of disease process that might cause them. For now, just know that the 6 perfusion parameters tell you whether or not your patient is likely to have an adequate perfusion to their vital organs to maintain life. Is your patient responsive to the environment? I think it's pretty obvious to most people that if a patient is laterally recumbent and non-responsive, it's an emergency. But there are many shades in between these 2 extremes of normal and non-responsive. Are they dazed? Do they look at you when you approach? Do they respond when you touch them? Have an idea of what normal mentation looks like for both dogs and cats. Anything that's not normal is a red flag to be considered. Normal mucous membrane should be pink to pale pink. Any other color is likely to be emergency or at least a red flag to be considered. Most people will say that the normal range for capillary refill time is less than 2. But just keep in mind that a capillary refill time of less than 1 second is abnormal. It can indicate a hyperdynamic state. What's a hyperdynamic state? That's another episode. A normal heart rate range varies widely depending on species, age, and size of the animal. It also changes based off of the anxiety level of your patient, and also changes depending on which textbook you're looking for reference. That being said, dogs of all sizes range from 80 to 150 beats per minute. Some even go higher than that, especially if they're anxious. Now, most people agree 160 beats per minute generally is considered tachycardic for a dog. For a cat, you're looking at roughly 140 to 220 beats per minute as normal. If you aren't already, start getting in the habit of taking a femoral pulse and assessing the pulse quality. An alternative site includes the dorsal pedal artery on the top of the back foot. Talk to your experienced techs and then have a discussion about how to describe what the pulse feels like. Some options are thready, bounding, strong, weak, and normal. After some practice, you'll learn to tell what a normal pulse feels like and what an abnormal pulse feels like. If you're having trouble finding a pulse, you may need more experience or your patient may be dead. Then you may have an emergency on your hands. Notify your doctor at your earliest convenience. Extremity temperature is often overlooked, but it's one more piece of information you can add to your assessment when looking for red flags. When a body is in shock and it needs to maintain perfusion to all of its vital organs, it does so at the expense of the peripheral parts of the body. That means the feet and tail. If the core is warm and the feet are ice cold, it can be a sign that the body is fighting to keep its perfusion in the most important spots. If the entire body is ice cold, then you may have an emergency on your hands. Notify your doctor at your earliest convenience. 7. Wait. This is supposed to be 6 perfusion parameters. What's going on here? I have included taking a blood pressure because it's a more direct way of assessing your patient's perfusion status. But we can't do this when the patient is out in front with the owner. Plus, it takes a little bit of skill, equipment, and more time to perform. So when you need to assess a patient quickly, check the previous 6 boxes for red flags and make a decision from there. When you triage, you have to know your normal ranges. Learn it, know it, live it. Now you may ask, what about abnormal values for the 6 parameters? Don't we have to know what abnormal means? Well, my response to that is that you don't have to know what it means to be abnormal. You just have to know what's abnormal. Your job at the very basic is to see something that's abnormal and say, that ain't right, and then go tell your doctor. Knowing what those things that ain't right mean, that comes with experience and study. But knowing what's normal and not normal without necessarily knowing what abnormal means takes only a few minutes to memorize. You can have that memorized by the end of the week. One final note. When you are measuring these parameters, don't hyper-focus on any one particular parameter. Take your whole patient into account and make a decision based off of all of the information. Okay, now, last but not least is the quick history. You don't have to get all of the minor details. Just get the biggest, most relevant pieces of information to make decisions for a treatment. The rest of the history can be filled in later by a doctor or a doctor's assistant. First is name and signalment. Signalment is a term that means age, sex, reproductive status, and the breed of the patient. Next, why are they here? Many hospitals have a pre-written laundry list of things that may or may not be emergencies, much like the one you saw at the start of this video. They can be handy things to have around, but are generally very text-heavy and not easily memorized. To simplify, things that I generally ask myself is it the patient's heart, lungs, or mentation? Do they have holes that are plugged that shouldn't be? Or do they have holes that are there that shouldn't be there that need to be plugged? Now, we need to know how long it's been happening. Also, are they eating, drinking, urinating, and defecating normally? Do they have any pre-existing medical conditions, and are they on any current medications? And lastly, another question that may be commonly relevant is vaccination status, especially for young patients. But it's not one of those core questions that I ask every single time. Depending on the answers to these core questions, an experienced technician may ask other specific questions to help guide treatment. Now, if you don't know, ask someone with more experience. It's never wrong to ask a doctor for further guidance. Now, with either kind of triage, I always err on the side of caution because at the end of the day, triage is all about judgment. By definition, you are using your best judgment to choose who gets medical treatment first and who must wait for it. The unfortunate truth is that if you have poor judgment, that can lead to dead patients. So, be conservative, especially if you lack experience. Rely on your more experienced team members for advice, and if you are an experienced team member and still unsure, ask a doctor for guidance. Doctors, believe it or not, you're the brains of the operation. But in all seriousness, you're the captain of the ship. You make the big decisions, and ultimately, a bulk of the responsibility falls on you. At the end of the day, what you say goes. You, as the doctor, have 3 main roles. If you're not surgerizing, diagnoserizing, or prescriberizing, you can punt it to a credentialed technician, and in many cases, a non-credentialed technician. Understanding how to utilize your support staff efficiently means that you can be more productive, wait times will be shorter for our clients, and our patients will get higher quality of care, which is really why we're here in the first place, right? So there you go, all you veterinary adrenaline junkies out there. A really nice down and dirty video on triage. We talked about the role of the CSR and how they can help keep the client experience smooth, especially when they work as a team with the technicians. We talked about the role of the technician and the 3 main components of triage: setting expectations, the primary survey, and the short history. And finally, a brief mention about the role of the doctor. That's it, guys. Thanks for watching. I'm Justin for Veterinary Technician Ambassadors, and remember, if there are no ups and downs in life, that means you're dead. We'll see you next time on Elevate.